Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Welcome back to the Pelvis Project. Hello, Roxy.
Hello, Megan.
Let's start off with a tell me something good. We need this.
Yeah. We do need this. Do you have something?
I do.
Go for it. You go first. I feel like I gotta think for a second here.
This last weekend, my daughter had her first homecoming.
Yes.
It
Was she so excited?
Yes, she was so excited. And it was just, she just looked so beautiful. Like, I just was shocked. Like, I mean, I know she's beautiful, but she's just such a laid back girl, doesn't wear makeup on a regular basis. Like, just kind of, she's like all about keeping her skin clear and all this stuff. And so to see her just glammed up and all, I mean, I was like, oh my gosh. I just kept saying you're just so stunning. And then Owen, when she walked out, her brother just kind of looked at her and he was trying to play it cool. And then we were in the car and he just kept staring at her because I think he was just trying to figure it out. So we gave him a hard time. He was like, what? I'm just so surprised you did this, Mom. It was so funny. But she just, it was so fun. And just every part of the day, in the middle of the week, we got a spray tan for her first time. Then we went and got our nails done on Saturday morning and then went and got her hair done. And she wanted it down and curled. And her hair doesn't hold curl that great for a long period of time. So, of course, it kind of fell out just a little bit. And so I had to touch it up. And she was just so relaxed about it. She's like, oh, it just kind of fell out. You can just add some curls to it. And in my head, I was like, oh, no, I hope she's not disappointed. And she she's not at all, she's so many kids could have just been like, oh my gosh. And so teens, but she just was like, oh, it looks great, Mom. Okay. So it was just so fun. And then I picked her up and she got in the car and she's just like, oh my gosh, that was so much fun. And then she went to the school, put on an after party. And so my husband took her over there and they bowled and played arcade games and ate food. And so she got home a little after 1 a.m. So it was her late night, but she had a good time. So it was fun.
It was fun. The girls, well, we have kind of a Saturday morning tradition. Not really tradition because it's not every Saturday morning, but a lot of Saturday mornings we'll run over to the library, the public library, and just check out books and whatnot. Well, it's been if they're good or if whatever. And motivation is that we'll check out a DVD.
Oh, fun.
We checked out Little House on the Prairie.
Oh my gosh.
So they're all about Little House on the Prairie right now, and we watched episode 2.
Oh my goodness, that's hilarious. Check out a DVD.
Yes. So anyway,
I love it.
The girls have been introduced.
They think it's great.
Laura Ingalls Wilder.
Yes, Little House on the Prairie.
And we have an elderly neighbor that's the sweetest. Well, they're husband and wife sweetest. And when we were leaving the library, she was bringing books back, and the girls told her, we checked out Little House on the Prairie, and she's like, that's one of my favorites. So they're bonding with our elderly neighbor over Little House on the Prairie before we even watched it. So it was just funny. Yeah.
That's awesome. I love it. Okay. Today's episode, we are going to talk a little bit about therapeutic ultrasound and how it can be helpful for nursing moms dealing with clogged milk ducts or kind of mastitis on the mastitis spectrum. So this is something that Roxy and I both offer at our clinics. And a lot of people don't realize that this is even available, what it can do, what this even means, how it helps. Kind of new guidelines for what a mom should do if she's noticing a clogged milk duct. I mean, from back when I was nursing until now, there's definitely different recommendations. And so, of course, when we provide this service, we are always working with doctors and IBCLCs, and if somebody doesn't have a lactation consultant, often referring to one at that point. But this can be a really awesome tool to use. And our goal with this is to get more women to know that this is available. Look into it in your area and see if anybody offers this if you're not local to where we are. And hopefully, this information is helpful to you. So, let's see, let's dive in. So, the Academy of Breastfeeding Medicine Clinical Protocol number 36. So, this is the Mastitis Spectrum Revised, and this was in 2022. So, this is pretty recent research. And the protocol lays out that therapeutic ultrasound uses thermal energy to reduce inflammation and relieve edema. So, therapeutic ultrasound may be effective treatment for conditions arising in the mastitis spectrum. Therapeutic ultrasound can be performed under the supervision of a trained physician or physiotherapist, i.e., physical therapist, on a daily basis until relief is achieved. And then it goes on to talk about the settings that you need to do. And really, the average, when it says it could be done on a daily basis, the research shows that in 3.3 sessions, so essentially 3 sessions, maybe 4, we've had some patients we've done 4 sessions, that should be what it takes for us to see a change happen with less pain, improved milk flow, all the symptoms have resolved. And so when I read that, I don't want anybody to think like, oh, we can keep going. And I have had women that honestly, we've done 4 sessions, had a weekend, and they were like, I just want to come back and make sure. And I'm like, sure, that's no problem. But basically, it is a tool that we can use to try to help that inflammatory cascade. And Roxy's going to talk next about how that actually happens. But one thing to keep in mind is, of course, while we're doing this, if patient has persistent symptoms, despite several days of treatment, healthcare providers should consider additional investigation. So, as we talk, there are clear guidelines of if you've had a fever for over 24 hours and all that kind of stuff, we need to be looking at getting into the doctor, possibly some antibiotics. But there at least is a tool. And even if you are into that, remember, this is a spectrum, this can still be a great tool. We have had women come in that technically have been diagnosed with mastitis. So we've moved from just a clogged milk duct to mastitis, and we're still utilizing therapeutic ultrasound to help in the recovery of that. And then in addition to that, we'll talk more too about what else we're able to provide in these short sessions. So these are just 30-minute sessions. So this isn't something, the ultrasound itself takes maybe 8 to 10 minutes. And then we have some gentle lymphatic massage, education. I just input some different tools that we can talk more of in our sessions as well, just as in general that most postpartum women should be doing. So that kind of introduces this, and to just know that like this is really awesome research and it's backed. It's scientifically backed.
So let's chat just about what is therapeutic ultrasound. A lot of people, when we say ultrasound, they think like the imaging.
Yes.
Like,
yeah.
oh, can you see what's going on in there? And
Yeah.
this is not that kind of ultrasound. So we're using it. It's a form of mechanical energy. It uses these alternating currents to convert electrical energy into acoustic energy. So think like sound waves, therapeutic ultrasound. And it transmits through the soft tissue, and breast tissue is very soft. And so it transmits through that. And so it has both thermal and non-thermal effects depending on the settings that you use. And so this also includes the acceleration of metabolic rate. It helps decrease pain and then increase circulation. Based on the settings, we can use that thermal or non-thermal settings depending on what we're working on. Some people may have gone to a physical therapist and had an ultrasound at one point. This is that similar. So if you're used to that, that's what this is. We're not looking at an image. We're using the sound waves to help with the tissue healing. And so basically, if you think about that inflammation that's happening with a clogged milk duct through the spectrum of mastitis, we really want to utilize that tissue repair that comes from this modality. And so during that inflammatory phase, then the ultrasound has a stimulating effect on things like mast cells. I'm going to use some big words here. Mast cells, well, platelets, we know what those are. White cells with phagocytosis roles, and then the macrophages that helps address that inflammatory phase. Basically, the application of ultrasound, it's going to induce the degranulation of mast cells. And we really want that because then that causes the release of a certain type of acid, which itself is a precursor for like synthesis of prostaglandins and leukotriene. And then these big words, these are inflammatory mediators. So basically, what I just said was there's this big cascade, there's this big like domino effect. When we apply the ultrasound to that tissue and to the inflammatory, all those words in there are dealing with inflammation. And so it's going to decrease the bad guys, increase the good guys, and work against that inflammatory process to help give your body the boost that it needs to then heal, like within this spectrum, whether it's the clogged duct that still has inflammation, like there's still an inflammatory process that can happen right there. And if that worsens, then it gets into the mastitis diagnosis category. But basically, we really want to catch this early, put this ultrasound on that clogged duct and be treating that clogged duct so it doesn't cascade and turn into this worst case scenario.
Yeah. So let's talk a little bit about what a clogged milk duct is. I always like to, I mean, I've seen this before by one of our mentors when we went through this training, but if you imagine a water wing, which I was talking to somebody about a water wing and they're like, I do not know what a water wing is. And I'm like, wow, times have changed. Everybody's using puddle jumpers now. So, but you think about a water wing, and if it is not blown up, it's just the plastic ring, it's just open. And so if you imagine as that is kind of the ductal system. And then when that water wing is blown up and it gets puffy and the center of it gets more narrow. So when that duct has inflammation in it, that's that water wing that's blown up. So now we have this inflammation sitting in this area where milk should be able to flow through. And so what typically happens is we have the inflammation, which has the pain, but now the milk becomes kind of blocked, which continues to lead to more pain and more inflammation of the breast. And so then this clogged milk duct, now we're having it have inadequate emptying from the breast. Essentially, what then that can do is the milk sits there and it will seep into the breast tissue where it's not supposed to be. And now we're building into this mastitis area where now we can have bacteria and that sort of thing happen. So if you can catch a clogged milk duct right away, when it's like, oh, I'm having a little bit of discomfort and there might be like a little bit of a red spot there. If you can get in to do therapeutic ultrasound same day, that's why we offer like same day appointments with this. You can try to nip this before it turns into bacterial mastitis or inflammatory mastitis. And the thing is those are so similar that often once you've kind of tipped the needle, they just go ahead and treat with antibiotics. But if you're somebody who's had mastitis repeatedly and you've had antibiotics over and over again, I would highly suggest this because this can help kind of get a little deeper to the problem and hopefully make it so that you're not going to have this recurring again. So one of the things that I thought was really fascinating when learning more about this and doing all the trainings is in our mentoring group, we actually had a lactation consultant that was in the group taking this course. And in her state, she could not be the one to deliver the therapeutic ultrasound. So she had to have a PT do it. And so she had somebody that was kind of like would come in and do the ultrasound. But the cool thing about it that I thought was neat was we were talking about the 3 sessions. And she was like, guys, now that I'm seeing these patients, like if I catch it literally right at the beginning, like first day, and I have that ultrasound done, like the second that we start to notice, she's like, sometimes it only takes 2 sessions instead of she's like, we do the full 3, but within 1 or 2 sessions, like symptoms are improved. So I thought that that was really cool because it really goes to show the power of this. And also I just hope that we can get this information out to more new moms nursing so that you can request this service if it's not just like talked about. Like if your provider or whoever you're working with doesn't suggest it, maybe you hear this and you're like, hey, does anybody in town do this? Because it really can make a big difference. Now, on the flip side of that, if you are coming in for this service and you are on antibiotics and we're doing your work and everything and your symptoms are not improving, we will always refer you back to your provider. There have been episodes where like everything was in the right direction, all the pain was gone, patient was taking their antibiotics. I've seen somebody once where they, for whatever reason, they had to stop their antibiotics. Everything was going great. And then they were off of them. And then things came, like it actually wasn't taken care of. But that's because we had gone more into this like, bacterial sort of infection type thing. We are always monitoring that. So that's hopefully that description of what a clogged duct actually is helpful to kind of think about the water wing little scenario. So,
Okay, so let's talk then about just some considerations here. I'm going to just run through kind of a list here of just some considerations that we have to be mindful of as we're either you're hearing this for yourself or a friend or us, obviously, as the clinicians. But just looking at feeding positions, tight muscles, even in the upper back and neck, and then obviously through the chest. We're looking at posture. Also, some things that can be looked at are hyperlactation and baby's latch, maybe even a pump like flange fit, mobility of the breast tissue, baby's mouth anatomy. So if they have tongue or lip ties or buccal ties. Some other things too, they're a little bit more rare is like a history of breast scars or surgeries, but still something to be mindful of. And then baby's head turning preference. Now, take into consideration as we talk about these considerations, that as PTs, we aren't the experts in all of these areas. And so referrals are very important, and like teamwork with this is really important. And so really, if we look at like the oversupply and the latching mechanisms, those are going to be best addressed and assisted by an IBCLC. And so that's something where we're sending to them or they're sending to us to kind of almost co-treat this, so that we're working on the inflammatory piece and they're going to work on some of those more like latching and mechanical pieces as far as feeding goes. And then when we're looking at like baby's anatomy, neck mobility, those kinds of things, a manual body worker that focuses on myofascial release is going to be really helpful for that. Pediatric therapists, different people like that are experts in helping like the baby's musculoskeletal system. PTs, OTs, they obviously can do that, but we are really wanting to find someone who would specialize in like the infant and pediatric development with that. And so that's a referral source then that we're going to look at. And then also we need to be mindful of just like the posture, the tight muscles. And that's where we come in. So we're going to be the number one for the therapeutic ultrasound delivery. That's not our only role in this healing process and in this treatment kind of protocol, if you will. We're going to talk about that in a little bit, but we're going to be doing some hands-on work in the clinic there, but then also educating and empowering these moms with strategies that they can be doing on their own at home in between sessions and moving forward.
yeah, yeah. I mean, I think about like when we're doing our ultrasound, it's not like us PTs can just sit mute and not like want to say anything. And so, I mean, I personally in our clinic really optimize this time. Like Roxy said, we provide handouts on upper back stretching and pec stretching, because here's the thing. When I was doing some more education on this stuff, it's amazing that we actually don't learn more about this in PT school. Because if we really are thinking about and looking at the musculoskeletal system through the pectoral region and those muscles that lay kind of right over the breasts, those often by the time we've had a baby are very tight, because as baby has grown and our breasts get bigger and our shoulders kind of roll forward and we get very tight, and then we just have a baby and we're really curved forward all the time. Okay. And so, and I'm using like non-medical terms here so that just a layperson would be like, yep, that sounds like me. So now we have these really tight pectoral muscles. Well, if we're having like these recurrent clogged ducts or recurrent mastitis or recurrent something, we need to be really kind of looking at the whole system here and be like, okay, what are some other influences? Like Roxy said, these are considerations. And so we really work on when we have our patients come in, we go ahead and add in like, okay, we want to do these stretches because if the muscles are tight down over the lymphatic system, the ductal system, all through the breast there's more compression. It limits the tissue mobility, the fascia system's tight, all of that, which can impact these things. And so we're talking about stretches. We're helping show different positions. Again, not taking place of an IBCLC because we aren't working on latch. We aren't looking at babies like tongue placement, all that. I always tell people, I'm like, it's not my thing. So get you to the IBCLC. But we can work on general posture things. I've also asked moms, I'm like, how are you sleeping? How are you eating? What is your energy level like? We're going through all these things. And I had one mom in the beginning of doing this that she had a pretty traumatic experience before I had seen her and had to be in the hospital right after she had her baby because of this abscess and like all these things. And when I got her, her nervous system was so revved up that any slightest discomfort she had in her breast, it was like, I mean, it just had her spiraled. And we talked a lot about, and we worked on breath work and we worked on, I mean, we can throw in some of the like pelvic down training. Like we threw that stuff in there while we were working on specifically why she came in. And as she started to be like, oh, wow, I mean, she did actually kind of just transition into wanting to get on our schedule because she was like, okay, let's do some more of this. But, in these sessions, if someone's moving right along, we have one area to ultrasound. I try to do some manual work on the spine afterwards. Like we want to try to help in more ways because the system isn't work in isolation. It's just like the pelvic floor. If this is happening at the breast, we want to make sure that we're addressing other factors. And also, we're another set of eyes on you. We're going to be seeing you 3 days, maybe 4 days in a row for a very short amount of time. And we can cover a lot of ground there. I've had a lot of moms that we uncover all sorts of things like maybe you should go get your thyroid levels checked. And they come to find out they need thyroid meds. Or, man, I am still having pain with intercourse. And, you're like, has anybody talked to you about vaginal estrogen because of genitourinary syndrome of lactation? And they're like, no one's told me about that. And so it's just kind of a nice thing also because we really can cover so many things. But as Roxy mentioned, it is a team effort as referring you for somebody for baby, getting you with an IBCLC. Obviously, we're working on you. And then we also might have to have your medical team involved.
Yeah, I agree. I think like you were saying too, it's like we can't help ourselves but to continue to throw in nuggets. Like we can't just sit there
I know.
quietly and not
I
just
know.
give these in or check in on people. So
All I'm going to do is this. And
yeah. No.
we actually didn't talk a little, one little touch on lymphatic work. We go through and kind of show you how to lightly drain your lymphatic system like into your armpit. It's not a full lymphatic massage. And so I have referred people out for that if needed. There is a taping technique also that we can do with K-tape that helps kind of lift the top layer as far as when I say top layer, lift the fascia a bit and the tissue a bit. And it can help with that too, which is really kind of cool. It makes moms feel kind of powerful and like badass because they have this like cool tape all over their boob. But there are those things as well that we're doing in those sessions. If we feel like they're appropriate, we use our clinical judgment on that. So we'll end with Roxy's going to start us off, but we're going to end with some do's and don'ts based off the most recent recommendations for if you have a clogged milk duct and it does not entail rigorously digging and massaging your breast. So Roxy, start us off on the do's.
Okay, so the first at-home recommendation is do use ice or cold packs in between feedings. This causes vasoconstriction and it's going to decrease the blood flow to that area, which is helpful because then that decreases inflammation. What we don't want to do is put heat on it, and that's been a historical instruction for this, and it kind of feels like that's intuitively what you're supposed to do is put warm on it. That actually is going to vasodilate, and that worsens inflammation. And so we're coming against the inflammatory piece here. And so we really want to knock that inflammation down. Cold is the trick. Don't do warm.
Mhm. So we want you to do nurse or pump on demand. So just following your regular routine. If you're weaning your baby, schedule changes, hand express or pump just enough milk to relieve pressure. Your body will soon get the message to make less milk and it will adjust. So, what we don't want you to do is during this time, add a whole bunch of extra nursing or pumping sessions. So, overdoing this can tell your body to make more milk. And since milk is made from blood, essentially, this would cause an increase in inflammation. So that's one that's like, wow, back when it was like, oh, I'm just going to nurse and nurse and nurse and get this to just pass, and really
Unclog the pipe.
unclogged it. It's not that. And so, yeah, something new. Maybe you learned.
Okay. We do want you to take NSAIDs like ibuprofen. It's a anti-inflammatory. It helps relieve symptoms. It's just going to give your body that boost. What we don't want to do is perform Epsom salt soaks, which again, intuitively, we think of like, oh,
Mhm.
inflammation or whatever, like that kind of detoxification. But stick with the NSAIDs. Don't perform Epsom salt soaks.
And I'm just going to say to that too, I have ran into some people that are like, well, I really don't want to take the ibuprofen if I don't have to. And I really encourage it. And actually, in the training, they encourage it for moms because we really do need to stop the inflammatory cascade. So it's not like you're going to be taking ibuprofen for months on end, but this is a time when it really should be utilized. So just keep that in mind. So the next one is do lymphatic massage. So start at the armpit, then massage from the clogged duct towards your armpit prior to nursing or pumping. So you kind of do this ahead of time. And that is on the flip side, we don't want you to vigorously massage the breast. So, like getting in there and digging, this can lead to tissue trauma, which would cause an increase in inflammation as well. So, a lot of people used to like use heavy vibration and get in there and dig, dig, dig. Again, it's just going to drive more inflammation, which could potentially then lead this to further down the line into mastitis.
Yeah, and the last thing is that we want to do is rest and hydrate. And obviously, this is easier said than done. In this season, we all know this is what we're supposed to be doing, but it doesn't
Yeah.
always happen. And so, but also recognize that along with everything else that you are doing now, on top of that, your body's trying to fight this inflammation. And so, it does need an extra boost that comes from that rest. That's a big boost in the healing process there. And then staying hydrated as well optimizes those tissues and helps flush that inflammation out.
Yeah, and I mean, I've had a couple moms that we've been working with that, have or have not had fevers. So we do wanna remember that if your symptoms persist and you develop a fever of 100.4 or higher, you're always gonna call your primary care, your OBGYN, right away. But some people, they almost feel flu-like, but they don't have a fever. And so I really encourage my moms when they come in to just kind of like take it easy for a couple of days. Kind of think of yourself like I kinda tell them, like, "If you need to blame it on me, blame it on me." And you can tell your husband or your spouse or your family, like, "Hey, I was told that I need to just kind of take it easy." Almost like if you were sick, if you will, just so your body can utilize its energy to heal. Because when you're nursing and you're taking care of a baby, we know the power and the energy and what that does and how much it drains you that if you're running on empty, like if you're already not sleeping because you have a baby, and then we have this inflammation, and now we're running on fumes, it is a recipe for disaster. And so I think with that, sometimes you just need somebody to kind of remind you that it is okay to kind of stop and be still for a couple days. And in fact, some of the moms that I've told them to, they're like, they come back and thank me. They're like, wow, you were really right. I just needed to have a couple days to just kind of like be by my bed or be in bed and have somebody take care of me and eat and get hydrated and sleep. Because I mean, just think about when you're sick, how sometimes just a really solid night of sleep, you wake up the next morning and you're like, okay, I feel so much better. So I think that these are just important things that easily get overlooked. So, we really do hope that this information was helpful and enlightening to know how therapeutic ultrasound can help with clogged milk ducts or anything on the mastitis spectrum. And we just highly recommend that you check out in your area to see if anybody's offering this and knows the protocols. And hopefully, if you heard this and you are not a nursing mother, you can share this and be a good friend and pass this along because it really can be a game changer. So, we hope that this information was helpful as a potential patient or as another provider, just learning more about this. And if you have any questions, please send us a DM on our social media, which is at the Pelvis Project. Otherwise, you can reach out to us individually at each one of our clinics, which will be tagged in the show notes. But until next time, we will keep this conversation going. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.